Dr. Lindsey here. In this little video, I'll talk to you about a lady that's had 3 short scar facelifts by me over the last 21 years. And so Patty is a lady that I met back in 2004, and here's her pictures. And at that time we did a little incision around each ear, and nothing in her neck plicated or sewed upon itself the tendon that holds the face muscles in place. Short scar facelift, trimmed off a little skin, and then closed her up. And here she is at a week. And then I saw her again in 2009, so 5 years after the first case. I think we did the same thing, plus we sewed her neck muscles together in a little tweak under local anesthesia. And then I saw her about 3 weeks ago when she and her sister came in. They're both now 74 or 75. I hope I'm half as fun as they are if I make it to 74. They've come to see my band a couple times, and they live life to its fullest. In fact, so she came in, she just wants a little tweak, and you have to be careful on older patients because you essentially lose 1% of the stuff that holds you together every year. And so, like if you're 50, the tendon that holds yourself together is about as stretchy as this, and so you can really pull quite hard. And when you're 70, it's no longer tough like that. You can pull hard, but it will just give away. It's probably the consistency of maybe a wet magazine cover. So you can pull, but if you pull too much, the stitches will pull through over the first couple of days, and then things will fall. So there's a trade-off. And so I talked to Patty and her sister both about, we got to do enough to make you happy, but not enough to make you look funny looking or to have it pull through. And so generally we do some neck work, and both of these ladies said they were not willing to give up their daily Coors Light in order to do that. And so if you've had any surgeries by me or been looking at them pretty uptight on you can't have anything thin your blood, and alcohol is something that thins your blood, for 10 days before. Now you could probably get away with it just out here in the cheeks, but in the neck that'd be a big problem. So they agreed they didn't want anything done to their neck. They just wanted really a short scar pull and nothing in the neck. And so here she is before, and here she is at a week, a little bit bruised. And then I will see her hopefully on August 17th when our band plays again, and try to get some pictures then. But this is an ideal tweak for younger patients, middle-aged patients who don't want extreme makeover, or older patients or somebody who's had a previous lift who just wants to look a little more refreshed, get rid of a little jowls and a little bit of laxity in the face. I've done about 4,400 of these things. I've had no big problems yet, and there's several other videos that show people that have had 2 or 3 of these things. If you're interested, we'll be glad to talk to you. Thanks.